I grew up in northern Illinois, south of Rockford, in a town called Rochelle, Illinois. It was a little town, and I lived there my whole life, and then I went to undergraduate at University of Dubuque here in town, and that's where I met my husband. He's from Dubuque, and then after that I did medical school in Southern Illinois University. After that I did a research year in Minneapolis at University of Minnesota. And then I went on to do my intern year in Milwaukee at Children's Hospital of Wisconsin. And then after that, I went to Madison for my residency at University of Wisconsin. So I've done a whole tour of the Midwest, and ultimately we ended up back here in Dubuque near my husband's family. And I really enjoyed Dubuque in college and was super excited to come back and raise our family here. I've been married for 10 years this summer, and we have 3 children. Our oldest is 6 years old, our second is 4, and our youngest is 1.5 years. We have all girls, so that's a lot of fun. Growing up, I guess I've always been kind of a projector. I always like to be doing things. I like to garden when I was a kid. I started cooking, and one day a week I would cook very elaborate meals for my family, and my mom initially loved it and then hated it when I would make an enormous mess in the kitchen. But it was yeah. Just I've always loved being hands-on and kind of finding ways to be productive and learning new things. I kind of went through every specialty in medical school thinking like, oh, I could do this, I could do this. So I was excited by a lot of different facets in medicine, and I found that dermatology kind of encompassed a lot of those things. So one thing that I love about dermatology is that I get to know my patients over the long term. So in dermatology, oftentimes patients are dealing with rashes chronically, or they are getting skin cancers from time to time, and we see them in follow-up annually. And so I really like that I get to make long-term relationships with patients. And then beyond that, I'm kind of a nerd, so I love the basic science in dermatology, rashes, really get into the nitty-gritty of how the skin works, and when we're treating those rashes, how those medications change the body and how they specifically help each different rash. And then I love to be hands-on, and so being able to help patients in that way is something that I'm definitely passionate about. And dermatology, lots of opportunity to do surgical procedures there. I'm really proud to work here. I feel like when patients come here, they trust not just me, but trust their primary care doctor. They trust, the other specialists that they're working with. I'm always really impressed by my colleagues and the ways that they're thinking through things, and then just what patients say about us. I'm always excited to hear that patients really are happy with the care they're getting here. They feel listened to and have trust in their doctors to do the right thing and take care of them.